Welcome back. US President Donald Trump has threatened tariffs of up to 200% on pharmaceutical imports, a move that could shake the global drug supply chain. What could this mean for Malaysia's pharmaceutical industry, and how should we respond? Prof. Datuk Dr. Syed Muhammad Al-Junid from IMU University weighs in.
In total, our health expenditure on pharmaceutical alone is around 16 billion per year. And of course, 17% of this is actually in the private sector, and the remaining 30% is in public sector. So healthcare cost is going to go up if really the US put us a very high level of tariff. I think for Malaysia, we need to strategize. We need to look at other supply chain if we are importing from countries other than US. For example, we should look at where drugs can be purchased from big countries such as China and India. They do have a lot of alternatives, especially on the generics products. That's one area that Malaysia can do. The second area is that we have to move toward more self-sufficiency in the future. In other words, we get to look at our possibility of producing our own drugs that can be used locally and produced by our own researchers. But this is, of course, needs a lot of investment. We have a big gap in terms of investment in health and also in investment in research. We need to spend more of it. Our investment on research is very, very small, basically, and this is quite difficult to manage the system. And on the other hand, we have ASEAN with us. We hold the chairmanship of ASEAN this year. I think ASEAN in total, we should be able to try to work together and see if we can actually purchase some of the drugs that are produced by other ASEAN countries, although it is not that much. But I think arranging for bulk purchases from maybe other markets, such as from European countries, that will give some advantage to the whole system in our country. It will help a bit to mitigate the effect of this huge tariff if it were to be imposed by Trump's administration on our pharmaceutical.
In the long term, Mohammed also urged stronger prevention of non-communicable diseases to reduce reliance on drugs and medication.
We need to find ways in order to reduce the use of drugs so much in order to manage this properly. So I'm a public health physician, so my priority is actually to find ways so that we can actually embark on more effective health promotion and health prevention, so that in long term the prevalence of chronic non-communicable diseases can be reduced. We should encourage more healthy lifestyle among the population, so that risk factors such as obesity, smoking, vaping that we're having at the moment could be reduced as much as possible. This is a long-term impact. In other words, our 20% health expenditure that we get every year on pharmaceutical can be reduced gradually if we are able to manage our chronic non-communicable diseases effectively.